All right. Hey, welcome everyone. This is the Buzz Studio W, your global radio network. We circle the globe 24 hours a day, 7 days a week, with the finest in broadcasting you can find anywhere around the world. And believe it or not, I can't believe it. Almost at the end of the year, this is our last broadcast, ladies and gentlemen. Our last broadcast of 2024. We'll resume in 2025. But I'm so proud to have a special guest on with us tonight. Before I get to that, let me bring in the panel. Tanisha. Tanisha Holmes is here.
I'm here. I'm actually in the stores, but hola to everybody.
Yep. And
Come on in.
Nakaya,
Okay.
Sister
Hola.
Nakaya, how are you? We've got
Well,
brother Robert Hicks. Hello, my friend. Hey, fellowman.
How you doing? Feeling groovy all day, every day.
And ladies and gentlemen, our special guest, Miss Naisha Frey. Naisha.
Hello, hello. I hope you can hear me.
Oh yes, loud and clear, loud and clear. I see some messages in the private chat here. We'll get to that in a little bit. But anyway, hey, it's great for you to be on. We're going to have a great show tonight because I looked at your resume a little bit, your brief bio that you sent us, and it is quite impressive. You know, on Group Swing Speaks, we try to showcase and bring out the best that our culture has to offer, whether it's business, finance, it could be in arts, education, business owners, you know, all across the spectrum. And today, Naisha has a very special skill set, and her vocation is quite fascinating to me because she's in the area that we all should be concerned about, and that is our health. Our health. And just a little bit, I'm gonna let Naisha tell you more about her story. She can tell it better than I can, but she's a trailblazer in health equity, community engagement, and advocacy. A proud Rattler. Oh, you from FAMU, Florida A&M University. Naisha combines her deep academic foundation with an unwavering commitment to empowering marginalized communities. As the CEO of Naisha Frey Consulting, LLC, she develops community informed solutions to address systemic barriers, amplify marginalized voices, and promote social justice. Welcome to the set, Naisha.
Thank you for having me.
Yes, yes, yes. So we're going to have a conversation. We don't give interviews. We have conversations, and we're going to go around the table. And I'm sure the panelists have a lot of fascinating questions to ask you. Tell us a little bit more about your background and why and how and who inspired you to go into the field that you chose.
Yes, thank you so much again for the invitation, for the opportunity for me to talk to the Groove Swing community. And I just want to give a special shout out to my favorite swing. I hope I don't offend anybody, but I hate to tell you, it is the truth. Raquel Rouse. I believe she pledged at North Carolina A&T State University. And she has been a shining example of your organization to me and to my family. With that being said, I also want to just share that, you know, I'm from Raleigh, North Carolina. I grew up here in the Triangle, Raleigh, Durham, Chapel Hill. And my time growing up here, I really got a chance to, one, get to know more about what it was to be a Black person, what it was to be a Black person that's Christian, what it is to be a Black person that resides and lives and hails from the South of the United States. And that was facilitated by my parents, my beloved parents. Karen Keys, who has been fortunate to be a part of this show in the past to talk about voter registration and voter participation. And then my father, who has passed away, Aubrey Amir Lamont Keys, who I love and who poured so much into me. And through them and all of the people that they brought into our village that helped to raise me, including our faith community and including a variety of organizations and leaders who were focused on social justice, civil rights, and understanding and respecting people of color and minoritized communities, I had this passion for my people, for Black people, for African American people. And because of that, I really started to think about, what were my talents and skills? And one of the talents and skills that I had was I really enjoyed talking with people. I really enjoyed listening to people. I really enjoyed helping people think through, tough situations and how to problem solve, right? And how to come out on top. And so I decided that I wanted to become a psychologist. And I specifically wanted to become a psychologist that served the needs of Black people. And so I went to FAMU, and that was one of the best decisions that I made in my life. From there, they really laid the foundation for me to be able to go to graduate school. And so I moved on from FAMU in the psychology department to Teachers College, Columbia University in New York City, which is where I met Bobby Roberts' colleague, Teddy Hatwood, who happens to be my favorite groove. And he has a lot of cool groove friends. But when I moved to New York, I met Teddy, but I also pursued my career in clinical psychology, worked on substance abuse issues, helped with revitalizing the lower Manhattan area and financial district in Battery Park City after 9/11. So I started to dabble in what I didn't know at the time was actually community health work, and in some new facets that I hadn't considered. And fortunately, I lived there for a while in New York City, and I decided I wanted to go home. So I went back home to North Carolina and was introduced to the UNC Center for AIDS Research. And at that point, my career ballooned and blossomed into much of what it is today, where I developed and dived into an area of my profession that I never thought I would enjoy, which is research. Going through graduate and undergraduate, statistics and research methods and all that stuff was probably my least favorite classes, but I got so much out of it. And so I started to work with people that were affected by HIV, people who were in the prison system, people who were trying to figure out how to live their lives more safely, as folks living with HIV. And I had the good fortune to also consult on different studies that were looking to solve problems that people with HIV were facing and their loved ones were facing. And so I consulted on global health studies. And as that career continued, I saw an opportunity for me to pursue another graduate degree in public health and health behavior. And so from there, I went on to UNC Chapel Hill's Gilling School of Global Public Health. And I studied long and hard, and I toiled. And I finished with what's called a Master of Science in Public Health, an MSPH. So most people are used to hearing an MPH. But for those who are out there looking for career opportunities and thinking about new avenues, an MSPH is also an opportunity to gain a high level of research and science training that is akin to what a PhD doctoral candidate would complete, but you don't go further into the dissertation process. You finish with your master's. And from there, I went on to work for organizations, the likes of Duke University, large CRO clinical research organization called IQVIA. And I wanted to start a company that would allow me to use my gifts and my voice to speak and talk about the things that I'm passionate about. And so I started Nyesha Frey Consulting LLC. And as a product of that, I also started the Questions You Didn't Ask podcast. So I'm also a podcaster, and I'm glad to be on this show. And so I will just kind of calm down there from this introduction and allow your wonderful host to chime into this discussion.
Yeah, well, I tell you what, I found it fascinating, and you are a health advocate, and we talked about, or what I gather is that you're an advocate. I think I put out on a post something about there's a lack of information that's being disseminated into our communities, and also resources. But before I get into more questioning, I want to go to Nakaya, and I'm sure Nakaya has some questions for you. Nakaya.
Hi, how are you doing?
I'm doing well, Nakaya.
Okay, so I did want to actually talk about your podcast a little bit. You're saying your podcast dives into often overlooked conversations. What sparked the idea for questions you didn't ask, and how did you choose the topics that you choose to talk about to explore?
Glad you asked that question. What really sparked it was I was in a phase of professional discovery and self-discovery, and I found myself looking for things to um, incite my mind and feed my intellect and feed my curiosity. And I was listening to a lot of different podcasts that I just found really, really interesting. And I started to take note. And I started to notice. I noticed that one of my good family friends had a podcast, and it was also very informative, very interesting, a lot of fun, entertaining. And I'm a talker. I've always been a talker. I was the kid that always got in trouble in school for talking too much in class. I remember in geometry, I had a teacher, and she is also beloved. She's a Black woman. And she had to tell me, now, Naisha, you got your lessons. You need to let everybody else get theirs. Okay. So I'm fortunate that I also have an amazing network of professionals. And we have these awesome conversations that I say, you know what? I think more people should be aware of all these wonderful things that are going on in our community and these different issues that we're facing. And there's so many conversations that don't happen, and so many professionals that don't have a platform, and so many solutions that are in progress that need to be amplified, because we oftentimes get overwhelmed by the number of things that are going wrong, whether that's in our personal life, in our social circle, or just looking at the news and seeing what's going on in the world. And so what I really try to do is not just talk about things, but that are going on that are troubling us, but also to look at it from a different angle and to invite my guests to talk about the things that inspire them, right? And the things that they see and the people that they follow and the initiatives that they know about that are really making an impact, and inviting my audience to get involved and to also share the knowledge, that as much as we look at social media, and I'm on social media, as much as we look at the news and all that other good stuff, there's so many wonderful things that are happening that don't get talked about because it doesn't fit the algorithm. So that is
That's right.
a little bit of why I started Questions You Didn't Ask.
What were some of the surprising or enlightening conversations that you had on the podcast? Like one thing that like stood out that no one has really discussed, no one has really delved into, that really caught your attention.
Yeah. So, I mean, it's my baby, right? So I love all the episodes for so many different reasons. I love all my guests, and excuse my phone if that's showing up on the audio here. Let me turn that off. But I think some of the conversations that really have resonated with people and kind of stick with me are one, my first series, which was and I should say that I'm in season 3. And
Okay.
my first season, series 1, thank you, was about infertility in the African American community, because we are very much, and rightfully so, concerned about maternal and infant mortality, maternal and infant health in the Black community. But what I knew from my own personal conversations with family and friends and colleagues was that there was an unspoken issue that was happening. There was an assumption that all women and all men can procreate, and that if they did not procreate, that it was because they didn't want to. And unfortunately, that is not true. Unfortunately, there's a lot of variation in our human anatomy and our biology and our chemistry and all those things that can make it really hard for people to conceive and to carry their child to term and to have a healthy baby. So I really wanted to dive into that and give that topic some air. I also really loved the conversation that I had about reproductive justice. And the reason for that was because I was able to invite a gentleman on my show who is from the South, is also a healthcare provider, also Christian. And he happens to be a gynecologist and obstetrician that performs abortions for people who need them. And having him on the show with a series in where it was called Reproductive Justice, Where the Brothers At. And we talked to him, Dr. Willie Parker, who is now retired. And I hope that he's doing I know that he's doing other great things. I don't hope, I'm sure he's doing other great things. To talk about reproductive justice and what was happening to our right to choose and have body autonomy and health autonomy and all that other good stuff from a Black man's perspective, which doesn't get talked about very often. There usually isn't a platform in there. And if there is, it's not often that a man and a woman are talking about these things. And he also talks about it from the perspective of being a feminist and what that means as a heterosexual man, right? And so he talks about that. I could go on. I have another series that is called I Cried Out, but No One Heard Me. And that was in season 2, series 2. I highly recommend this one. I called out, but they didn't hear me. And this is about the unique health disparities and health equity issues that Black people in the United Kingdom face. So I was fortunate to have a physician, Dr. Marianne Farrow, and a famous and highly regarded researcher, Dr. Gifford Ramey, both Black people, talk about from both a clinical and research and diversity, equity, and inclusion perspective, what are the unique and similar health issues that they face in the United Kingdom, especially as a place that has what we consider universal health care. So those are just some of the topics. I've got more that are coming. One that's getting ready to hit the airwaves is called Ready or Not, the conversation that the Black and Latino community needs. And we're going to face some stuff.
That sounds interesting. I love the fact that you guys are talking about infertility in the Black community. I think, especially just to have a male guest on there, to have his perspective on there. You're right. I don't think that a lot of Black men have a big platform to actually talk about women's health. And sometimes if a man does, it's usually perceived negatively by the audience that's listening to them, and they'll actually bring some negative connotation to it. So to actually have somebody that's in that profession and actually discuss his concerns is very enlightening. And then I know that you're also into healthcare and trying to help out the Black community. I know one of the topics that I like to bring up is just like how you're saying infertility with the Black community is also the disparities in healthcare for women that are pregnant, and how sometimes they get some sort of prejudice in the hospitals that aren't doctors of people of color. A question that I do have for you is, what are the biggest challenges that you faced with your consulting company, bridging gaps between healthcare institutions and marginalized communities, and how you think you can overcome?
Those are good questions. I think the biggest issue that we have when it comes to addressing health equity is I'm going to say political will, but when you're thinking about corporations and organizations, we don't always think about politics. So what happens there is just the leadership's willingness to commit to doing the work that's necessary and sticking to it despite the naysayers, and despite slow change.
Mhm.
So in corporate environments, and healthcare is often not that much different than corporate environments. We are interested in fast, quick innovation, change, impact, results, significance, all those other things, right?
Mhm.
And unfortunately, what I am and a lot of other people are doing is saying we have to change the way we do things because we continue to do the same thing over and over again and expecting a different outcome.
Called
So
insanity.
exactly. So so in order to, make a real change, you have to recognize that these behaviors, and remember I have a specialty in health behavior. These behaviors, these attitudes, these concepts, policies, practices, programs, processes, right, have been indoctrinated into these structures, these organizations, these cultures for decades, if not centuries. So the idea that you would use a 5-year grant model or a 5-year program model to see significant, measurable, quantifiable change and financial return on that project seems like it doesn't seem like it is asking for a lot, right?
Mhm.
So
I
making
would
the
call it
business
microwave
case,
results because you're expecting to get
yes,
things done in like few seconds. 5 years
right,
can go by so fast.
exactly. So that within and of itself is a major issue. What I do to try to overcome that is I'm looking for currently and always partners, philanthropic groups, businesses, organizations, leaders, and that is also a part of why my podcast is so important. Who are looking to be committed to this work, who are looking to do things differently, who are looking to give opportunities in new ways. There's certain groups that are understanding that having funding that is a little more unrestricted and trusting the grantee to do what's necessary with appropriate, reporting and all that other stuff with funds can help to free up organizations to provide more innovative solutions, right? And to do what they know needs to be done.
Mhm.
Um, there are other organizations that are specifically looking at and looking for um, Black and minority led professionals and groups to lead these efforts in their own communities. So it's a matter of looking for and identifying, and another reason why I'm glad to be on your show, partners that are interested in making those types of investments, collaborating in this way, and starting to be equitable in their internal processes as well as their external programs and funding models. So it is a little bit of looking for a needle in the haystack, but these organizations and people are out there.
Okay. So I have
Fascinating.
one more question, then
No,
I
take your time. Please continue.
because
No, continue.
her knowledge is just phenomenal. So I was actually taking quite a few notes here. I am going to check out season 2, episode 2. I'm going to watch that. And yeah, definitely check out your podcast. I know you have another podcast. I'll probably get to that later. But the one thing that I do want to kind of ask questions is you've had opportunities like being a guest panelist for you're saying Presidential Advisory Council on HIV and AIDS. What was that experience like, and what impact did it have on you on your advocacy work?
So as I mentioned, I am just so fortunate. I want to take a moment just to give a little bit of a testimony, not too much. You don't have to bring out the tambourines or nothing like that. But um, oftentimes it's really important to trust God Trust God in terms of the doors that he opens for you versus the doors that you are praying to open up. And the reason why I say that, it kind of goes back to um, um, how I said that I didn't want to be a researcher. So I didn't really want to be a researcher, but being a researcher invited me to be a part of one of the having those skills, I should say, allowed me to be in spaces and to take on roles that exposed me to phenomenal people right in my hometown. And one of those is Dr. Alicia Diggs, who was the featured guest on my highest performing podcast series about living with HIV in the African American community. And she is a member of the Presidential Advisory Council for HIV and AIDS. She actually just posted today that she finished her, I believe, 4 or 5 year term on that council. And so as they were planning their meeting, she put my name in the hat. I have been doing a lecture for UNC Chapel Hill and their HIV AIDS course, which is both a graduate level course and a undergrad course, specifically in the School of Public Health. And I teach not the whole class, but one of the courses in the class. So a lecture in the class on HIV in the African American community. And she happens to help organize that class. So when I was on that panel, I was able to talk with people who were doing work globally, who were doing work domestically, especially myself. I tend to focus more domestic issues, but I don't shy away from global issues. And then also a person who was transgender, who was also doing advocacy work in the HIV community. I believe she was from Atlanta. And that conversation was very rewarding, in that I made a number of connections in my home community because of that. With different researchers and leaders in the area, I was able to continue to give back to UNC Center for AIDS Research by reporting out on what was discussed in that session. And I continue to utilize a lot of the talking points there moving forward in the work that I did. Because not only was the preparation important, but also the conversation was important in terms of helping me to formulate new ideas and helping me to think about new different strategies from different angles. So anytime that you have the chance to collaborate and work with people and to sit down and talk to people who have similar values, they might not have the exact same identity, they might not have this exact same approach. But if they have something in common with you and you have the similar passion, you can oftentimes grow a great deal personally and professionally from those experiences. And I'm very proud of that opportunity.
This is a wealth of information. We'll go to Tanisha, because there's so much information I want to, and then when we come back around, we want to talk about the disparities in our in various communities. You know, everyone doesn't get all treatment, doesn't or isn't the same.
No,
We
it's
will
not.
talk about that too, and we'll talk about the educational aspect of it as well. Tanisha.
I can actually touch on 3 things, but I want to know about, like, have you ever done any type of research as far as like with the media? Because I noticed a lot of times when you see like the advertisements for the HIV medication, it's always someone that looks very, very similar to us. Have you ever done any type of research for that? Because it almost looks like it's a stigma in our particular race per se versus any other race. And I always notice that. You know, like the reason behind all that?
Yeah. So one of the reasons for that is because unfortunately we are the leading racial ethnic group that is impacted by HIV. That is the truth of the matter. One of the reasons why I have been so passionate about working in this area is because the more that I learned about it, the more that I realized that HIV in a lot of ways is a personification of a lot of the social cultural ailments that the Black community has had to face.
Mhm.
The reason why I say that is because when you look at HIV, it is a virus. It is a virus that is contracted through personal contact, right? Very intimate personal contact, not just hugging, not just shaking hands. I'm talking about unprotected, and can I use the correct anatomical terms here?
You can.
Vaginal and anal sex, okay?
Mhm.
Um, and where people's bodily fluids, their internal bodily fluids, can be exchanged with another person's, usually internal bodily fluids. We're not talking about, oh, that person spit on me and it hit my open sore and now I got HIV. No,
Mhm.
that's not what I'm talking about.
Mhm.
Okay.
Mhm.
So when we think about HIV and the fact that it has to do with sex, most of the time, it also has to do with IV injection drug use, right?
Mhm.
So when you're talking about IV injection drug use, there is blood that gets in the IV needle when you inject, and then if you share that needle or reuse it in any kind of way, you share it without cleaning it properly. Okay, there's always preventive measures that can prevent transmission. Without cleaning it properly, then you can pass it on to someone else. One of the things that I thought was really interesting about that was when I started to do, and see, I do what's called social behavioral research.
Okay.
And to answer your question, I don't do specific research on the media.
Okay.
Okay. I talk to people that are affected, right?
Okay. Got it. Okay.
Whether they live with the virus themselves or they're at high risk for it, or they know someone, what have you. So what I found that was really interesting was that in the Southeast, especially, and in very poor communities,
Mhm.
people who had diabetes were getting HIV. Why? Why? Because sometimes they couldn't afford to get fresh, clean needles.
Mm.
And so they might reuse or they might share, right?
Mm.
There were other instances that I thought was very interesting about HIV transmission. When we think about the Black community and when we think about our relationships, right? Who are we having romantic and sexual relationships with? Overwhelmingly, the Black people tend to stay with other Black people. Now we know that there's all types of rainbow coalitions and free love and everything else, but generally speaking, when you compare the Black African American in particular population to other American racial ethnic groups, we tend to coalesce together. So that means our pool of people is smaller because we're already only 12% of the population.
Yeah, 12% of the population, right?
So our circle is smaller. We tend to
Mhm.
congregate together. And then when I looked deeper and said, well, why is that? I looked at the history.
Mhm.
And what we know on this show, and a lot of your listeners know, is that there was a long history where it was illegal to have a sexual or romantic relationship with someone other than your race, and especially if you were Black. So it was literally illegal for us to have these intermixed. So now that's baked into, remember I talked about the decades and centuries and the social and the culture, that's baked into who we are. So once you limit your sexual and reproductive pool and you throw in there the fact that there's like HIV and AIDS kind of moving around, that along with a number of other factors that I won't unless you want me to, can exacerbate the numbers and we stand out. And on top of that, once we stand out because we're Black, we're poor, we're under-resourced, we're undereducated, then people start to say, oh, well, it's not affecting, gay white men as much anymore. They seem to have money, they seem to have resources, they seem to be able to get their medication, they seem
Right.
to do whatever.
Mhm.
And so I guess it's all right now. We're good.
That's what you're saying. Okay. Mhm.
So that's just it in a little bit of a nutshell. I mean, I can go a little deeper, but there's a number of different things we can talk about along these lines.
And okay, and I want to touch on the IVF. Actually, I was married before,
Mhm.
and I think I may have shared this before with the panel. And so when you're going through the IVF treatment, it's very expensive. Your insurance typically do not cover it, so you have to come out of pocket. It runs between $15,000 to $30,000 pop, one chance, and that's it. So my ex-husband actually is a lighter complected brother who's actually half black, half white, half Colombian, if that makes sense. So automatically, and I'm glad that you touched about the IVF process too, because there's not enough education, there's not enough knowledge about enough information in the Black community when it comes to IVF, because a lot of times a lot of African Americans cannot afford that. You know, that's one thing. The insurance doesn't cover it. And a lot of times people don't think it's conventional, it's unconventional because it's not quote unquote godly per se. You know, you're trying to force something that shouldn't take place. But what I realized with my first set of doctors, they automatically assumed that it was the African American woman, which was me, right?
Mhm.
They didn't look at him because he's a lighter skinned person. So I actually had to end up going to an Ethiopian and an Egyptian doctor that realized, hey, it has nothing to do with you, sister, because I'm still pretty fertile at almost 50 years old, if that makes sense. I'm telling everybody my business, but that's okay because I eat good pomegranates, you know, papaya.
Okay.
Okay. Okay. I mean, this is the show. We've been raw. We're going to be raw. But my point I'm saying to you is that, you know, if I probably want to have a couple kids right now, you know, I don't know what they'll turn out like, but, you know, but that's one thing too. But I wanted to kind of touch on that too, because so often the first thing, the first course of when it comes to a Black woman having issues with fertilities per se, they want to take out your reproduction system. They want to eliminate the reproduction. There's so many Black women that actually die without the reproduction system, without their uterus. And I refuse to actually go through that process. But my point I'm saying to you is that they automatically assume when you're talking about disparity when it comes to the healthcare and within our community, when it comes to IVF and infertility, we don't touch on that a lot. And they automatically think it's the female. And a lot of times it's actually the male, as far as like defragmentation. And I know I touched on this before, and especially the sperm quality that can determine if the egg's going to continue to grow. And a lot of times women of color actually suffer from high prolactin levels because of the stress that we have to go through in order to maintain the household. But I think it was a great subject that you actually talked about on your podcast as well. And I like to share that because that's my personal experience. But as far as like that goes, it's not typically the African American female. Sometimes it's the males. Like 45% is actually the male, not the woman. I just want to just kind of touch on that too. And I forgot my third question, but you know, I'll probably get back to that. So what's your take on that?
We'll come back around the table. Let's hear from
Okay.
Brother Robert.
Okay.
Okay, we'll come back around.
All right, no problem.
All right, Robert.
Yes, absolutely. Thank you very much for being on the show today. This is Aisha, and I probably would say one of the things that's definitely important is, I would say, just maintaining your connection to your various different audiences, as you have, or you say you have a consulting company, and definitely the idea of being able to provide services to help out the communities as a whole. And I saw one of your Instagram postings, and I'll post this in a moment. But tell me a little bit more of the details of what you go into when it comes down to your consulting businesses for the audiences in general. And that will definitely be of assistance to someone out there who needs, or probably would say that, hey, I need a little help in the area, and maybe Sister Naisha could provide some assistance. You're on mute right now, so that's okay. That's okay. We'll fire the technician. It's no problem, because
no. It's all on me. I did that. No firing. No.
The technician is a person in the back room. He actually is somewhere in the walls of our system. So actually, we'll just happen to just pull him out and just WB will take care of it. But continue.
Oh goodness. Yeah. So, what service do I offer? That's a very good question. So, one thing that I do want to do is draw people's attention to my website, NaishaFrey.com. My name is spelled NIASHA Frey, FRAY.com. You can go on there and learn lots of things about me, about my services, about partnership opportunities, even see information about my podcast. And so when I talk about my business, I offer services in 4 different areas. I'm not missing one. One is health communication, primarily questions you didn't ask, my podcast. The idea with questions you didn't ask is being able to take really complex information like your guests have just shared and make it very easy to understand and make sure that there's evidence-based information that's help informing the discussion, right?
Mhm.
And bringing different experts in to talk about these things, right? The other area is patient advocacy. So oftentimes you will have either a healthcare institution, a researcher, a pharmaceutical company, maybe a medical device company that is looking to create something for a particular patient population, but they may not know that much about the lived experience of those people
Mm.
and what it is that they need in order to make their lives better. And if their product or their service, their program, their research, or their pharmaceutical is really going to fit their life. In this area, I tend to focus a lot around HIV. I tend to focus a lot around disability justice, specifically Down syndrome. I'm learning more and more about autism just because of the circles that I'm in. Also, cancer, specifically breast cancer. But I've worked in a number of different areas of health related issues. The other area that I work on is community outreach and engagement. Same types of target audience, whether it's hospitals and healthcare providers, researchers, pharma companies, medical device companies, different health service organizations need to know how to engage with the community, how to effectively do community outreach, how to develop meaningful, bi-directional community relationships, right? And not just show up when they need something, but show up also when the community is celebrating, show up when the community is mourning, show up when the community is in need, and get to really understand who they are in order to have effective partnerships and collaborations. Another area that I have expertise in, and trust me, this is over 20 years and counting that I've acquired all of this expertise, is in diversity and inclusion in clinical trials. So as I mentioned, you may have a clinical trial and you all may be aware of this, but the majority of our medications, devices, healthcare procedures and processes, research innovations are based on the participants who are predominantly white, male, sometimes female, but definitely white and female, if that's the case, and middle class. Sometimes that has to do with who has the time, who has the availability, who has the access, who is what we call the convenient sample. They're also the majority of the population here in the United States. So how do you make sure that your clinical trials are diverse and inclusive? Well, some of that might involve how do you communicate, your health communication. Some of that might involve how do you advocate for your patients? Are you advocating for them? Do you understand what they need from you? And or it might have to do with your community outreach and engagement. So even though these are all different areas, they all relate to each other. And the final area is community informed metrics and evaluation. This is something that I'm very passionate about. I'm very passionate about all these things. But when we think about measurement, when we think about measuring impact, how do you know that you have made a change? How do you know that this person's behavior has changed? How do you know that that change is sustainable? Oftentimes, when we're thinking about measuring those things, it's from the perspective of how will I impress the institution that I work for? How will I impress the funder who's giving me the money for this? How will I impress my colleagues who may be in the position to promote me or give me more access to more opportunities? What we don't often think about, which I think is starting to grow in popularity, at least in terms of a buzzword, is how do we communicate back to the people who participated in the study that gave us these results? How do we communicate back to the people and communities that we went to ask them to participate, whether they actually participated or not? Do these people see themselves in the results? Do these results matter to them? And then how do we make sure that this information is accessible to them? How do we make sure that this information is actionable for them? Oftentimes we focus more on presenting our results at a conference presentation with other colleagues, other funders, other organizations, or maybe our own. We also think about publishing in peer-reviewed journal articles. Those are platforms that create barriers that are institutionalized and baked into their structure. Only certain people know who, what, when, where, and how to get that information or to
Mhm.
get access to that information. Oftentimes, our scientific journals, you can't access them unless they are open, right? They're open access, which, can be very expensive for researchers to submit, because basically what that is that the researcher themselves takes on the cost of publishing their research so that other people don't have to pay for it. So guess who has that kind of money? Not
Right.
us. Okay.
Right.
So
Mm-hmm.
then you also have journals that will publish your research free to the researcher, but the person that is interested in finding that information has to have some sort of professional affiliation with that journal.
Mm-hmm.
They must have an institutional access through maybe their institutional library, or they have to have some other way that they can get through that firewall. They might be able to read the abstract, but they're not going to be able to read all the methods. They're not going to be able to read all of the background. They're not going to be able to read all the results and understand the conclusions. So these are some of the things that I try to help researchers, healthcare providers, innovators in the health industry overcome with what I call community informed metrics and evaluation. And you can learn more about that on my website, Niasha Frey, Niasha, Niasha, Frey, Fray, at, no, there's no at, it's .com. Thinking about my email.
Sister Naisha, within the constructs of our community, we talked about, and that's how ideas are formed, and the lack of information and lack of knowledge. You really can't form an opinion or come to a solution if the information isn't afforded to you. And let's talk about the lack of information or the lack of resources. And so what we're saying, if I correct me if I'm wrong, are you saying that in certain communities, the information is not the same? It doesn't disseminate down. It doesn't get to the people that are concerned about it. And we talk about disparities. And I would say that the disparities, based on what I'm hearing and based on what I know, is that has always been that education and information and even resources are limited in our communities. Do you want to? Would you address that, please?
Yeah. So one thing that I always have to say is that we are not going to pathologize our community ever. And I'm not saying that that's what you're going to do, but I'm going to couch what I'm about to say in that. Oftentimes there's a lot of information coming at us rapidly all the time from a lot of different directions. We
Okay.
as Black people have learned to be guarded for the sake of survival. And we have learned to be suspicious of information for the sake of survival.
Right.
And so oftentimes what happens is there's information, and COVID-19 and the pandemic was a classic example of this. There was a lot of information that was out there. There was a lot of conflicting information that was out there. But until someone that you know and you trust brings you their interpretation of what is happening, you may not buy into what the status quo is suggesting, right? So that's one thing, is that you have to have people who have enough education, enough understanding in order to share accurate information for you to make an informed decision, right? You also, as the sister mentioned before, want to make sure, is this for me? Because as I mentioned before, a lot of the research that we see and the results that we base all our policies and practices on is off of a model that is predominant, like overwhelmingly, it's not even representative of the population. It's just overwhelmingly, dramatically and drastically white, right? And so we're like, well, is that how it works for me too? And so we're always looking for a Black doctor, a Black nurse, a Black judge, legislator, and we're also trying to figure out now, is this my kinfolk or my skin folk? What are we doing? So we've got we've got a lot of layers that we got to work
That's true about that.
before we can make a decision about, is this information pertinent to me and my life and the life that I want to live. And so in this information age, there's a lot out there. And so what I try to do, much like what you guys try to do, is I try to speak to the people who will listen, right? I try to prove myself as much as I can. I like to say I can show you better than I can tell you, you know, to be consistent, to be true to who I am, and to show and prove that I'm the same today as I was before. And that there's no real switch up other than the fact that I've gained wisdom, right? And so that helps, right? I've gained experience, so that helps. And I also have gained a network of people where if I don't know the answer, I can call on some folks and say, hey, this brother or sister needs some guidance or is confused about XYZ, or will you come on my show to talk about this thing? Because I keep getting all these questions. You know, on my show, I'm oftentimes not the expert, right? On my show, I'm oftentimes a facilitator. On my show, I'm the one that's also curious. On my show, I'm the one that will give some, you know, some public health data, some background information on the epidemiology. I might break down some of the data and the statistics to show you trends and help you understand why this topic is so important to us. And then I lean on my guests to really fill in the blank and color in the gaps. So having as many of these platforms that we can to be able to showcase what it is that we know, what it is that we're passionate about. I'm not talking about hobbies, people. I'm all about people having hobbies and, you know, all that stuff. But I ran the gauntlet. I'm so sorry. I ran the gauntlet at some of the highest level institutions, and I've earned my badges. You know what I mean? And so now I'm trying to use that information to impart knowledge and wisdom on people who will listen, right? And who are looking for new opportunities and new solutions to problem solve and help them to navigate this world. That was a part of my motivation for going to college in the first place. Let me go and learn some things and bring it back to my community. Because why? One person can't be everything all the time for everyone. But if we all take our skills and our talents, and each one of us stays true to that and comes back to the community, comes back to the village and shares what we know, then we can all make each other better. So that's a lot of where I come from in terms of how do we navigate this information age, and how do we use our skills and talent to help impart information that can be really useful and helpful to our community.
All right. I promise. I can't believe we're almost out of time. How did that happen? How could that happen? I mean, it was like we just started this program. I would go to Nakaya. They go around. I promised Tanisha that she'll be able to get back in, and Robert.
Tanisha, if you remember your question, you can go ahead and ask it.
Well, I don't remember, but I was going to mention something to her about community healthcare workers, like basically are the boots on the ground. Is that what you're talking about too, as far as like being great advocates, as far as like with the research and gathering the information that you need to be able to, to be able to know exactly what's going on within the community, within the areas that are actually not been served or been underserved, as far as like utilizing community healthcare workers, CHWs.
Community healthcare workers, I have to say, I'm familiar with them. I know a lot of research about how effective they are. I have colleagues that are dedicated in terms of bringing opportunities and resources to help formalize community health workers in our health system because of how effective and powerful they are. I have also worked on a COVID-19 project that utilized what we call lay health advisors, which is very much like community health workers.
Yep.
That are those, like you said, boots on the ground, those people who have been trusted in the community, those people who are willing to pick up that mantle and be able to walk the streets, knock on doors, meet people where they're at, and provide them with the information that they need at the time that they need it. Even if it's a ride to and from the doctor's appointment, right? Someone to hold your hand while you're waiting for your results. Someone to help you to understand what is and is not being said in that clinical appointment, and someone to pray with you. So I just think that the community health worker model is amazing. And I really look forward to, I'm going to speak positive, look forward to community health workers and other health workers, healthcare providers, and the rest of us receiving the pay that we deserve and that we need and that we're valued, right? And that this becomes an actual, career that people can, spend their life doing and hopefully live a long time doing that work. But right now we're not at that phase where it's truly sustainable as a career. And to be honest, when I look at the economy and the job market, I don't know what is sustainable. So I guess community health workers are sitting right there with the rest of us.
I actually work as a community health worker through the Center for Disease Control, so CDC. So I'm on a 5-year plan. So I'm actually one of the boots on the ground as far as been an advocate for the monkeypox, the vaccines for the COVID. So I basically, whatever you have said to me, it radiates with me because of what I do on a regular basis throughout the week. And that's why I work with the underserved community. So, it was my favorite words. Kudos to you. So,
kudos right back at you.
Yeah.
Hey, Nakaya, before I go to you, Nakaya, I was talking to Sister Naisha, and I said, this is going to be a fascinating show.
Oh, yeah.
It's going to be fascinating. And it's gone by so quickly.
It has.
But I'm going to leave everyone else to get back in. Naisha, I'm going to ask that you do come back. Because we only scratch the surface.
Yeah.
We only scratch the surface. And I want to talk, and when you do come back,
I'm sorry.
You funny too. I wanted to also talk about your work and if you are, and research mental health. Really, we want to address that as well. Nakaya?
I know we only have a little bit of time, so I'm going to reserve my questions for when you return. All right.
Okay.
But I definitely didn't get a chance to want to dive into more of your podcast, and we even get into your other podcast, which is the Ageless Intimacy, where you're talking about healthcare and sexual well-being of women that are over 40. Now we did touch on it a little bit with Sister Tanisha about the IVF and a few things like that. But I mean, I know that's a very expansive topic to talk about because. I know I'm sorry, I'm not 40, but I have friends and I have family relatives that are, and I hear some of the changes, the body changes that they're going through, the mental changes, the hormones that they're going through, and they don't know sometimes what to do when it comes to premenopause and then menopause and libido, all that, just to get to the basis of it. And I really wanted to kind of dive into you with that. About the discussions that you do have on your podcast. So I really do hope that you come back and we can delve into your podcasts and discussions that you have, and then even in extensive research that you have done onto it. I know it was your least favorite thing, but for me, if someone gives me a study, I'm reading it and I'm highlighting. I'm oh, did you know about this in 1947? So it's I like the research and I like to.
Now I do.
Yeah, right. Knowledge is powerful. And it's even more powerful when you share it.
Absolutely.
when you're telling people, you know, what you learned and what you know, and especially if it's factual, you never know what that information can do for the other person that's listening to it. So
Absolutely. Absolutely. Yeah.
Robert?
Yeah, so I want to say thank you very much, Sister Naisha, for being on the show, and also just sending love from my friend Teddy Hatwood, who basically just says hello to you, and I just had a chance to speak with him earlier today. And definitely it's important, especially understanding all these various different issues that go on within our community, because it's definitely important that everybody understands that you never know what another person goes through. And you
Right.
definitely need to be able to be kind to every single person that you come across, and also being able to help out where you can. If you're not the solution, you are a part of the solution. So make sure that you reach out and make sure that you help everyone, brothers and sisters, family alike, especially this holiday season. And just want to say that, you know, thank you very much.
Yes. Sister Naisha, is there anything that you want to say? Is there a question that we didn't ask that you wish we had?
You stole my question on my show.
I know.
You've been listening. I love it. I love it. I love it. You all just keep doing what you're doing. I'm glad to come back. I actually want to learn more about what you guys are doing. We're going to really have to have a group discussion. I'm going to have to start asking y'all some questions, especially the sister at CDC. I mean, I'm saying we got a lot to talk about.
We got a lot to talk about, don't we?
Yes, we do. But yeah, just check me out on social media. I'm on LinkedIn. I'm on Facebook. I'm on IG. Questions You Didn't Ask is on all major podcast platforms. You can watch it or listen to it rather on your favorite podcast platform. Please subscribe. I love my subscribers. Subscribe, like, comment, share. Let's get involved.
I certainly will. No question about it. You've been delightful, informative. The only problem is that we just ran out of time. I can't believe it. Unbelievable. So that means that you are phenomenal.
That's right.
I appreciate it.
Absolutely.
Thank you so much. Thank you so much for joining us. And ladies and gentlemen, this has been another phenomenal episode of Groove Swing Speak. So, hey, stay tuned. This is our last broadcast.